Welcome to Meet the STEM Professional, the podcast where we explore the journeys, challenges, and triumphs of experts across science, technology, engineering, and mathematics. I'm Sophie, and in each episode, we sit down with a STEM professional to uncover their experiences, insights, and advice for aspiring minds. Let's dive in. Today, we're talking to Sarah, a physiotherapist. Hello, Sarah, and welcome to the Meet the STEM Professional podcast. Can you introduce yourself and give us your current job title and role?
Hello, Sophie. Yes, I'm Sarah, and I am a Band 8 physiotherapist. So I lead the A&E, the acute emergency service at St George's Hospital, which is an acute trauma hospital. We look after patients that have come in following a fall, those who have come in with new fractures, and those who have reduced mobility. Our aim is obviously to get patients home as quick as possible, prevent them from coming into hospital and needing more care and to try and prevent them from getting an infection and further down the line.
Fantastic. So could you describe what your role entails on a day-to-day basis?
Yeah, so as I'm the lead, I have to make sure that there's enough staff on the ground to ensure that the patients are being seen on a timely basis. I have to make sure that the consultants and our therapists are liaising with each other to prevent patients staying in hospital longer than they need to. We make sure that we see our patients within a 2-hour window so that those patients who are earmarked to go home can go home, and they get their drugs and everything in line with the hospital guidelines.
And what exactly does a physiotherapist do?
Good question. So a physiotherapist in the emergency sector will go in and assess the patient and take a social history. So they'll ask a patient about their current setup at home and how they're managing. They'll ask them whether they have any support on a daily basis. They'll see how and if they're able to cook for themselves and take themselves to the toilet and wash and dress themselves, especially those who are more elderly. And if we establish that there's a need for care, then what we can do is send a social worker to go and assess them in their property, or we can put in a provisional package of care when they do go home to support them on discharge. Once we've established all of that, we will do a physical assessment. So we'll have a look at a patient's mobility. So we'll have a look at them getting in and out of bed, on off a chair, going to and from the toilet. And if they require something like a walking aid, like a Zimmer frame or a walking stick or a crutch, then we can issue one of those, and then we'll send in a community therapy team to work on their walking and help wean them off that when they do get home. If they've had something like a fall on admission, then we will also send the community team in to see if there are any trip hazards, and if there are any other things that we can provide. So like a falls monitor, so like a watch that they can wear at home. If they get in trouble, they can press it, and the emergency services or their relatives are alerted. And then for younger patients, what we would do is we would have a look at someone's scans. So when someone comes into hospital with an injury, they'll tend to be X-rayed or MRI'd or CT'd, depending on what they've come in with. We'll look at their X-rays and their scans, and we'll chat with the doctors and see if they're eligible to get walking and have a look at their mobility. If they are, then we'll assess them, and we might need to brace them if they've broken their back or their neck. And then we can work on rehab, and then they'll be sent to a ward if they need more rehab. Or they might be sent to a rehab centre. So yeah, it's a really variable job. We work alongside occupational therapists who also pop in equipment, and they'll have a look at someone's seating if they haven't got sitting balance and things like that. So it's a very varied job, and we see a lot of acute different in illnesses and injuries in the acute sector.
And have you always worked in A&E, or have you delved into other areas of physiotherapy throughout your career?
No, so that's the bonus of being a physiotherapist. So I have worked in a lot of different areas. So when I first started, I did a lot of respiratory work in ITU, where I helped patients with their breathing and helped suction patients when they had really bad chest infections. Then we worked on getting them in and out of bed, but that took a lot of time. to progress them, then we would follow them to a ward and work on their mobility. Like I was saying, we would get them sticks or frames and work on their mobility that way. And then as soon as we felt that they were eligible to go to a rehab centre, we would send them on for further rehab. And then I moved to St Thomas's in London, where I did more of a paediatric role. So I worked with little boys with Duchenne's muscular dystrophy, who required a cough assist to help with their chest function. So muscular dystrophy reduces your need to your ability to cough, so your cough strength. So we used cough assist to help suction and get rid of any any kind of chesty cough that they had. We also did lots of seating and things like that and hoisting them into a wheelchair. And that I thoroughly enjoyed. That was really rewarding. And I work with a lot of tracheostomy patients, so that's where they have a breathing hole through their neck instead of their mouth or their nose. And that requires lots of looking after and care. So that was quite a specialist area that I worked on. Then I worked in paediatrics, so with little babies, working in the intensive care setting, looking after babies who are really poorly, which I found incredibly hard. So I decided that I would do something slightly different, and I did a ski season in Val d'Isere as a physiotherapist, working with patients who had come off the slopes with a shoulder or knee or back injury, and found that really enjoyable because I could combine my love for sport and my love for physiotherapy. Um, so I then moved back to London, and during that time, I got a job in a private physiotherapy um, clinic. And I learnt a lot about Pilates and rehab and how to tone and strengthen up specific muscles following a sports injury. And I thoroughly enjoyed that and worked my way up and was a managing director there. And then COVID struck. So my job wasn't that secure because it was a private job. So I then decided that I would go back into the NHS, and I worked with the COVID patients. So I went into COVID ITU, which was quite scary after 8 years of being out of intensive care. But again, my colleagues supported me, and I went back to using the ventilators, which was thoroughly eye-opening and an amazing experience and something I'll never forget. Then following that, I got a job in A&E, and I've been in A&E for about the last 4 or 5 years. So I started at UCLH, which was an incredible hospital, teaching hospital, and now I am a senior in the St George's Hospital.
So, from all those experiences, which ones do you think were maybe the most rewarding, and which one do you think was probably your most fun experience?
My most rewarding was probably working with the children in the Evelina, because they are and working with the teams. So obviously as a physiotherapist, you work with the MDTs, the multidisciplinary teams, and the nurses, the doctors, and the other therapists are just so incredible. And I'm in awe of them. I don't know how they do it every day, because it is very heart-wrenching work, but absolutely amazingly rewarding when the babies get to go home and the toddlers get to go home. Also, I guess in COVID ITU, when we could get patients up and walk them on ventilators, that was pretty incredible. And actually, that reminds me of a time when I was in St Thomas's working in ITU. I worked with patients on what they call ECMO. So that's essentially where your blood is being oxygenated outside your body. So
Oh, wow.
you carry lots and lots of tubes, and you have to have lots of staff members. One of my main roles at St Thomas's was a critical care rehab therapist, and I worked solely with the ECMO patients. So it took about 12 staff members to get patients up out of bed during this time, because they needed so many people to hold the tubes and be on standby just in case something happened. But I worked with a girl who very sadly had lupus and then got sepsis and lost her legs and her fingertips. So she then had to be rehabbed in the ITU setting. And then I went down to rehab her in the Lane Fox unit. And I actually ended up a couple of years later going to her wedding and watching her walk again down the aisle, which was absolutely incredible. So, I mean, what can be more rewarding than that, hey?
That is a really, really lovely story and a wonderful ending. So we're going to track back a little bit. So we've heard about your career and all the different roles that you've held. We're going to track back to school. So what STEM subjects, so that's science, technology, engineering, and mathematics, did you enjoy studying in school, and why did you choose to take those further into kind of the sixth form?
So I obviously did the core sciences, so I did double science GCSE. So that involved chemistry, biology, and physics. I really enjoyed biology, and I also really liked technology and what you could do with it, and how you could advance, um, looking at things, and how it's kind of got progressed, has been absolutely amazing with therapy and looking at scans and things like that. Um, so yes, so I loved biology, and I know this isn't a STEM, but I loved doing art, and so I knew I wanted to do something practical, and I wanted to do something using my hands, and kind of I wanted to do a vocational um, qualification. I didn't want to do something that where I sat at a desk all day, and I don't end up sitting at a desk any of the day, which is what I really enjoy. I do have
Yeah,
to write notes, obviously, and we have to write patient confidentiality notes to make sure that everyone knows what we've been doing with the patient. But um, most of my day is on my feet, talking to people, talking to relatives, speaking to patients, and that's what I thoroughly enjoy about my job.
perfect. Well, you said you did art. So you did art through A level.
Yeah,
And actually, there is another term that we use in STEM, which is STEAM, to incorporate art, because design and making things look pretty is how you get people to interact with what you're making or what you're doing.
yeah,
So how does well, so you said that you did a vocational subject at university. What did that
yeah.
look like at university?
So at university, physiotherapy is a 3-year course. So it essentially involves the first year is learning about anatomy and physiology. So very biology and science based. You learn about the nerve innervations for each muscle, and how your body functions, and what attaches where on each muscle and bone, or sorry, on each bone. Um, so incredibly interesting, how um, and how you can manipulate the body to make it feel better if something's slightly sore. So we did a lot of manual therapy techniques in my first year. And the course was split into 3 different sections. So you have your musculoskeletal, your nerve, your neurology, and you have your respiratory system. So we had different lectures on different things. And then they would have a viva, so a practical section where you would go in and talk about what you'd learnt about the lungs and the heart, or around the body, or your musculoskeletal system, or your nerve innervations in neurology. So we specifically things like um, multiple sclerosis, Parkinson's, or MND. Physios are really highly involved with things like that. So um, we learned, I guess, the first year we learned all about that, and then in our second and third year, we are sent out into the big bad world. So we are given hospital placements where you stay in a hospital for 6 weeks, and you basically learn on the job. So you're given different rotations essentially. So I was given pediatrics in the community um, in Oxford, and then I moved to Windsor where I did breast cancer, which was incredibly niche but really interesting. We got to watch surgeries and see how people were rehabilitated after those surgeries. And then I went to MSK in Slough, so I learned all about all the different gym sessions that you can do with patients. And so it's incredibly varied. And then after each placement, we get assessed. So we were given a grade. And then from there, you would see, like, how you were managing and what you kind of wanted to
Yeah.
specialize in and what you were good at.
That's a really interesting way to kind of study, that you're studying on the job, and also you kind of get a taster, almost like an internship into each area, and so you can see where you really want to go through your
Yeah,
career.
exactly.
That's cool.
Yeah.
So how do you think studying STEM at school and at sixth form helped you to kind of prepare for your career?
Well, I think I think in any case, it's really important to be in a job that you're interested in, because if you aren't, then obviously it's not going to be very enjoyable. So something I was really interested in was the human body and the function of the human body, and I was also really interested in helping people.
Yeah.
Um, so I think that I had a very inspirational science teacher who really helped me through my science exams, and I was really interested in continuing science. And actually, I thought about doing medicine because my parents are both doctors, and unfortunately, I didn't get the right grades in chemistry to do that. But physio is probably what I don't know. I don't know whether it's better, but for me, it was the better option.
It's the
It
better
gives you
option.
more time. It gives you more time with patients. And you get to build a better rapport with patients. Unfortunately, now the way medicine's going, you don't get very much time. Don't get very much time to spend with patients, and it's very quick your meetings. But actually, as a physio, you get to spend a little bit more time, do a bit more rehab, and get a bit more social history, so that you can then plan their discharge and make sure that it's a safe discharge for home, for example.
And so why would you encourage students to look at physio as a career option or to go forward in the medical world?
I think it's such a varied career, and I've done so much with it that it allows you to, I mean, it allows you to travel. You can do it abroad. You can go to Australia, New Zealand and work there. I've got friends who are physios in New Zealand and they absolutely love it. There's so many different elements of physiotherapy that you can go into and specialize in. I mean, I obviously have quite a broad background now, and now I'm in A&E, so you get exposed to lots of different illnesses and lots of different uh, acute acutely unwell patients. But that's not to say that I don't also do Pilates on the side, and I do, sports injuries, and I look after women who've just had babies and help them with their rehab. So it's incredibly varied, um, and it's really fun. I love it, and yeah, I think it's a really really enjoyable career to be doing. So look into it.
And what skills or mindsets are particularly important for success in your area?
Skills and mindset. I guess obviously being a people person and being able to talk to people and understand, their problems and listen. Being an active listener is really important, especially in my current role. So when patients come into A&E, it's really important to listen to what they're saying, and when when they first became unwell, what happened, get to the bottom of what's going on at home, so that you can support them in the best way possible. Skills, I think you obviously need to have, biology under your belt, and you need to be able to understand the physical and physiology and anatomy of the human body and be interested in it. Um, and obviously, what else do you need to do? I guess
Oh,
be
that's
able
from
to
it.
interact, be able
Yeah.
to interact with the MDT.
And I guess one of the things that you said earlier was being caring. Do you think that's
Oh
important
yeah,
in?
absolutely. That is a very
Yeah.
important one. Yeah, being caring and being
Yeah,
kind and being open to change, and being able to adapt your your knowledge so that you can use your exercise base that you have in your head for different patients and different
different settings.
and progress them. Yeah, in different settings.
Fantastic. So have you got any kind of final words of encouragement or for students thinking about studying STEM subjects?
No, I think it's a really important part of your learning to learn a STEM subject. And I'm certainly going to encourage my daughter to do a STEM subject. Hopefully, she'll be interested in one of them. Um, but what else? I guess look into what you're interested in, and do something you really enjoy. Is my takeaway from that.
Well, thank you very much, Sarah, for your valuable time and advice.
Thank
That
you.
brings, that brings us to the end of this episode of Meet the STEM Professional. We hope you found inspiration and valuable insights from our guest today. Stay curious, Keep exploring, and we'll see you next time.